Clayton was born healthy, you know, beautiful baby boy. Our dreams were answered, his sweet little guy, and a little over 2 years after he was born, Clayton got his first fever. It went from one fever to the next, around the clock, day after day after day after day.
It was probably, you know, when we started going into the second week, and you know, we're back to the pediatrician 2 and 3 times, that we really started to get concerned that there was something else there.
So a neighbor grabbed our 5-month-old for me, and I packed a bag for one night, and we headed to this local hospital. He was admitted, and he stayed there and remained there for 2 weeks.
They advised us that, you know, the best thing to do would be to take him over to Hopkins, where he could get more specialized care. I could tell from really the moment that we met Dr. Lederman and had some initial discussions with him about Clayton's condition, that he had this suspicion that he knew what it was. And he figured it out.
I was suspicious from the beginning that normal children don't have pneumonias that don't get better. And while it might not be the only explanation, that a problem with his immune system was one explanation for why he was having such a difficult time.
I claim this mountain, Mount Pirate. Woohoo!
His immune system is broken. Not all parts of it are broken, but an important part is broken, where certain mold and bacteria his body doesn't fight off like a normal body does.
Nice try, Slim.
Clayton is not any more susceptible than anybody else to getting the flu or recovering from the flu, but he is much more susceptible if he gets exposed to certain kinds of bacteria and certain kinds of fungi. So as an example, one of the places that the germs live that we worry about in a CGD patient are in dirt or piles of mulch or old leaves.
We work around it. You know, he has a little play area here at home that we found some rubber mulch. He likes pirates, and you know, one of the things that we did with this rubber mulch is we were able to kind of bury treasures, and he can go out there and pretty safely dig in the rubber mulch.
We found it!
And he can be as normal as he'd like to be. So
I don't like getting shots.
Clayton has medicines that he takes every day, and actually twice a day, and he also has injections 3 times a week that he does. And this helps his body fight off those kind of everyday things.
I can take these without water, but I shouldn't.
I expect that sometime in the next 10 years, we're going to figure out how to do gene therapy in a way that is safe and effective, and that CGD will probably be one of the first diseases for which gene therapy is going to be tried, and I'm sure going to be successful.
Making a paper airplane.
So I'm really confident that before he's an adult, that we're going to have a way of curing this disease in him.
Now I think you fooled it.
One thing that just makes me at ease is knowing that we have Hopkins Childrens there for us, and that they know us and know how to care for Clayton, and they will go to battle for us. They are just wonderful, wonderful people. Just knowing Clayton is Clayton, he's gonna be fine. I just know it.
You ticklish?